Hi, my name is Grace Lang, and I'm excited to talk to you today about trichotillomania. Before we jump into what trichotillomania is, though, I want to ask you, have you ever felt like you were born into the wrong generation? I remember this phrase being used a lot when I was in junior high. I never really related to it until I was sitting in an art history class last year. My professor put this painting on the screen. She told us about how, according to 15th century beauty standards, thin eyebrows and receding hairlines was the epitome of beauty, so much so that people would shave their hair back and pluck their eyebrows. In this moment, I finally understood what people meant when they said they felt like they were born in the wrong generation. That is because I have trichotillomania. My laptop is often littered with eyelashes, and I have to keep my glasses with me all times in an attempt to keep myself from pulling out my hair. Sometimes I have lots of eyelashes, other times I have none. You can also see that my eyebrows are a victim of my hair pulling as well from these pictures. Trichotillomania, also known as TTM or trick, is a neuropsychiatric disorder characterized by chronic repetitive or compulsive hair pulling resulting in noticeable hair loss. Symptoms of trichotillomania include irresistible urge to pull one's own hair, which can be focused or an automatic response, repeated attempts to stop, or a growing tension in resisting the urge, sense of satisfaction, relief, or pleasure after plucking out hair, biting, eating, chewing, or general playing with pulled out hair, and hair loss marked by bald patches, hair thinning, shortening, sparse or missing eyelashes and eyebrows. TTM is part of a larger category of behaviors called body-focused repetitive behaviors, or BFRBs. These include any repetitive self-grooming behavior that involves biting, pulling, picking, or scraping one's own hair, skin, lips, cheeks, or nails that can lead to physical damage to the body and have been met with multiple attempts to stop or decrease the behavior. My family pedigree is completely filled with various BFRBs. Me and my brother both suffer predominantly from hair pulling, whereas my dad and my oldest sister pick at their acne, my mom picks at her lips, and my sister picks at her ears. Trichotillomania has many causes, such as genetic predisposition, other mental health conditions such as depression, anxiety, OCD, body dysmorphic disorder, post-traumatic stress disorder, attention deficit hyperactivity disorder, and substance use disorder, and environmental factors such as stress and substance abuse can also play a factor in TTM severity. There's evidence that trichotillomania is caused by a heterozygous mutation in the SLIT-RK1 gene on chromosome 13q31. SLIT-RK1 is found to be involved in neurite outgrowth, which is required for the complex interplay of both extracellular and intracellular signals. One twin study showed that concordance rates for monozygotic twins was 38.1%, and dizygotic twin pairs were 0%, using the Diagnostic and Statistical Manual for Mental Disorders criteria, and 58.3% for monozygotic twins and 20% for dizygotic twins using the non-cosmetic hair pulling criteria, leading to a heritability estimate of 76.2%. While there does seem to be a connection to the SLIT-RK1 gene, recent studies haven't replicated this data, suggesting that more genes could be involved in this disease and that more research is necessary to finding the root cause of TTM. The gold standard treatment for trichotillomania is habit reversal therapy, a form of cognitive behavioral therapy, or CBT. Other psychotherapeutic treatments that have also proven to be effective include comprehensive behavioral treatment, acceptance and commitment therapy, and dialectal behavioral therapy. The underlying theme with these psychotherapeutic modalities is focused on developing awareness of triggers, including reducing the guilt or shame that may accompany the condition while developing improved distraction and coping skills. Pharmaceutical treatments for TTM include N-acetylcytosine and olanzapine. Other behaviors, such as wearing hats and glasses or habit-aware bracelets, can help people with TTM develop awareness of their triggers and distract or prevent them from pulling. Trichotillomania is a chronic disease with ebbs and flows of good and bad periods of plucking and pulling. Little concrete research has been done on treatment options and root causes of TTM. More research on both effective treatment options and the root cause of trichotillomania could give hope to those who struggle with TTM.